Hello, everyone, and welcome back to our Muse Professionals webinar. Thank you so much for joining us. It's such a pleasure to be here with you all today. I can't wait throughout the webinar to get to know you a little bit. And today, we're also really excited to welcome Lori Gill. She is the founder and clinical director at the Attachment and Trauma Treatment Center for Healing. She's a registered psychotherapist, certified trauma specialist, trainer, consultant supervisor for the National Institute for Trauma and Loss in Children, and former psychology professor with 18 plus years of experience working with children, youth, and adults in various settings. Her diverse experience in nonprofit organizations, employee assistance programs, and in private practice have provided her a wealth of skills in the areas of trauma, attachment, mental health, compassion fatigue, prevention, addictions, eating disorders, and education. Lori has actually been using Muse at ATTCH and has found it to be an excellent resource to enhance and supplement their treatment. Today, she will discuss her work as a psychotherapist and trauma specialist while exploring apps and programs that can be used in conjunction with Muse for assessment, monitoring client progress, and neurofeedback training purposes. Lori, we are so excited to have you with us. Thank you so much for joining us. I'm very excited to learn from you this evening and to hear about all of the wonderful things that you've been doing and how you've been incorporating Muse into your practice. So I'll now pass it over to you.
Wonderful. Thanks, Laura. Are you hearing me okay?
I am indeed.
Wonderful. I'm so thankful to be here and appreciate the opportunity to speak to you about how we use Muse in our practice. And I'm thankful for all of you who are joining in on the webinar to learn. I'm going to go through just basically an overview about our treatment approach and the different ways that we use Muse, as well as some of the apps. And at the end of the session, we will have some time for questions. But I'll start with just talking a little bit about our treatment center and to give a bit of background. So I actually opened our treatment center in 2013. We focus on trauma and attachment dysregulation and have been incredibly busy since, because as many of you, if you're professionals, probably know, there's a lot of trauma, unfortunately, that does happen, and treatment is something that's not always readily available in that area. So what I'd like to do tonight is talk about how clinicians, helpers, individuals who are experiencing adversity in life can use Muse, as well as other strategies along with Muse, to promote health and well-being in their life. So with that being said, I'm going to switch off the camera. I just wanted to say a quick hello first, and then we'll go through some of the slides here. Okay, so when we look at what we do at our center, I wanted to give a little bit of an overview. We work with all ages, children, youth, adolescents, adults, prenatally as well. And we work with individuals who have experienced trauma or attachment dysregulation. You'll see we have a yoga style room on site. We also do art, play, body movement, and somatic therapy, as well as some traditional therapies. And are very excited to have the Muse as part of our mindfulness and neurofeedback training program, which I'll touch on shortly. When we look at what trauma is, just briefly, because that's what we specialize in, I think it's important to have a sense of what that means. For us, it truly is any event that causes an individual to feel powerless, helpless, fearful for their safety. And this is very important when we're working with clients, because quite often what we're working with is affect. We're working with their nervous system, and tools like Muse that allow us to regulate their nervous system can really enhance treatment. So we don't really focus so much on what has happened. There are many things that can happen in an individual's life to cause trauma. But we certainly focus on the meaning that an individual has formed of that and the impact that that's having on them at a neurophysiological level. One of the most pervasive traumas that we work with would be attachment dysregulation. So we work with many different forms of trauma. Attachment dysregulation really stems from the knowledge that we have that we're born primed for that secure connection, attunement, attachment from our primary caregivers, and that really does lay the foundation for our nervous system, primarily in the first few years of life. And unfortunately, we work with many people who haven't had that secure foundation and then have accumulated trauma experiences on top of that. So again, we'll talk about how the Muse can be used to help with connection to self as well as connection to others, because awareness and mindful awareness is certainly at the root of that. So a little bit about our treatment approach, and then we'll get into some strategies. We are integrative in our treatment approach, so we use best practice approaches such as structured sensory interventions, somatic, so body-based therapies, art, play, body movement, mindfulness, yoga, biofeedback, neurofeedback, meditation, EMDR, eye movement, desensitization reprocessing, EFT, meaning emotional freedom technique, and evidence-based structured sensory interventions. And you know, our treatment approach really is unique to that individual. So although we're focusing on trauma and attachment dysregulation, we're weaving in practices to help supplement our approach, and the Muse is certainly a fantastic accompaniment to that. One of the things that we understand when we look at early life experiences is there's a lot of research around adverse childhood experiences early in life and how these experiences, as I mentioned earlier, are impacting our nervous system. But they're not only impacting our nervous system, they're impacting things like mental health, chronic disease, so physical health, later in life, increased risky behaviors, poverty, crime. We see intergenerational transmission of trauma. So there are a lot of layers that stem from these early life adverse experiences that we have. When we come back to that nervous system dysregulation, one of the things that's fantastic about Muse is it allows us to see what's happening internally and get that feedback, that biofeedback and neurofeedback instantaneously to understand what's happening. I was doing clinical supervision with a group today, actually, and they had just purchased the Muse based on our last session. And one of the therapists said, you know, it's fantastic because as I started using it, that real-time feedback allowed me to notice when my thoughts were wandering and allowed me to kind of refocus my attention back. I'm just seeing a little note here from Laura mentioning that certainly as you go, if you click on the chat box, you can type in questions, and those will be shared either at the end of the session or as we go, depending on content. So please feel free to ask questions as we go to make this as relevant as possible. So when we're working with this, this affect, I have a picture that I'll show you shortly, but the Muse, as I said, gives us that opportunity to actually see what's happening. We work with a lot of individuals who have, as this slide shows, this activation that becomes their norm. It becomes what's familiar for them. And when we're in this constant state of arousal or this constant state of shutdown, it can really feel like we can't shift out of that. And being able to see the capacity that we have ourselves through guided visualization, through sensory feedback that comes from listening to the sound of the waves with Muse when you have it on, all of that allows the client to see the capacity that they have to shift how they're feeling internally and what's happening neurologically for them. And I think that that's really exciting. When we look at what's happening neurologically with trauma, and this is just a very brief summary, but I think it's key to understand when we're doing work with trauma and when we're using tools like the Muse, because there are so many ways that we can use it beyond just kind of the base approach. Bessel van der Kolk, a leading expert in the field of trauma, says, you know, when we have trauma, when the system breaks down, we become like conditioned animals. And he says the moment that we detect danger, we automatically go into fight or flight mode. In PTSD, it's the critical balance between the amygdala, the smoke detector, or our security guard, as some people may call it, and the medial prefrontal cortex, the watchtower, that shift radically and make it harder to control emotions and impulses. And he says intense emotions cause people to take leave of their senses. And I'd like to just give you a little visual. So I'm going to switch back to me for a moment. And some of you may be familiar with this, but I think it's a great resource for clients. And this is Dan Siegel's model, and he talks about a hand-brain model. And he talks about that, you know, if we think of our hand as a model of the brain, and this is a great analogy for clients, parents, even for ourselves. He says, you know, this would be like our spinal cord, the arm or wrist area. And then at the base, we would have our brain stem. And this is, you know, present prior to birth, very basic survival functions. And then we have our midbrain, and in the midbrain has some things that that help with emotional regulation, like our amygdala. So that amygdala, again, is that security guard. It likes to scan for threat and danger. We have our hippocampus, which is linked in with emotional memory and learning. And then at the top here, our fingers is the part of the brain that most of us want to work with all the time. And this is our higher order logic, reason, cause and effect, motivation, willpower. So this is the prefrontal cortex, and it's the last part of the brain to fully develop. And unfortunately, most of us are, those of us who are professionals, are receiving referrals for people who are not motivated, who don't have willpower, who are not using logic and reason. They're not emotionally regulating. And he provides a great example for this that ties in with Bessel's quote, in that we know that when we have these big body experiences in the right hemisphere, so sight, sound, smell, sensations of touch, but emotions as well, and particularly trauma, these emotions are really, really big, and what happens is it causes us to flip our lid. And when we flip our lid, we lose access to logic, reason, rationalization, cause and effect, as well as speech. And this has been demonstrated through work that colleagues at Western Ontario actually are doing, Dr. Ruth Lanius and Dr. Paul Fruin. And we actually see that the left hemisphere has little to no activity when we're recalling trauma, when we're emotionally charged. Our speech centers are often offline, which is why quite often people can't talk about what happened. Often we'll get an I don't know instead, and that's a common freeze response. So this is where, you know, there's no amount of talk that's going to help somebody shift. Sensory strategies absolutely will. So using sight, sound, smell, sensation of touch, the pitch, tone, cadence of our voice, that helps us shift. But what we ultimately want to do is strengthen this higher order part of the brain. Right? This is where our strategies are. And this is precisely what something like the Muse does. When we're doing a mindfulness training, it's that serve and return with our brain that's strengthening the capacity for when our mind wanders to notice that it's wandering and bring it back. And it wanders again, and we notice and we bring it back. And the beautiful thing with the Muse is that, you know, it gives us that live, beautiful feedback with I really like the waves, but there's lots of other soundscapes you can use. But with the waves that show us, oh, you're shifting, and helps us to kind of redirect that attention back. The other piece that ties in nicely with that as an example is big brain, little brain. And so little brain would be the amygdala because it is in fact smaller, but mighty, and big brain would be that prefrontal part of our brain because again it is bigger. But unfortunately, if the amygdala kicks it offline, even though we may have lots of strategies up here, we can't access them because it's offline. So it requires us, when we're regulated and calm, to practice strategies to train the brain to increase integration between the right and the left hemisphere, but also between the lower and the upper regions of the brain, the nervous system, the heart, etc. So I'm going to switch back here, but hopefully that little visual was helpful to some of you. Okay. So Bessel van der Kolk says we really need to work on achieving the balance between the amygdala, that, you know, security guard, and the medial prefrontal cortex using bottom-up or top-down approaches. So our bottom-up approaches would be things like using our nervous system, using our body to regulate our mind and our brain, And the top-down approaches would be using our mind to regulate our body. Okay, one of the really nice things about some of the somatic approaches is we can promote regulation without necessarily getting into the trauma, which is another fantastic thing about the Muse. We can train the body to calm and train the brain to a state of calm without delving into details that may be distressing. Now, of course, part of my job is to delve into those details in a safe, structured way, but that's not what everybody has the training or the scope of practice to do. So having tools like this to help reinforce regulation are really important. All right, so a couple of tools and how I like to use them, and I'm just going to continue with kind of framing this through a trauma perspective. I know there are lots of professionals you've heard from and people who have been using this far longer than I have, and certainly at a far more sophisticated level, but this is how we use it at our center and find it to be quite helpful. Part of our role, in addition to doing trauma treatment, is actually doing comprehensive trauma assessments. So when I'm doing an assessment, when I'm doing treatment, I'm constantly monitoring affect. So I'm looking at eye contact, vocal prosody, breath, posturing, facial tonus, to help me understand, almost as social markers, about what's happening with an individual's social engagement system, whether they are in a regulated state, whether they are in a state where they're perceiving threat, or whether they're perceiving life threat and going into a shutdown state. And this is really important, and I would say, I think I'm pretty good at tracking the affect, but it's fantastic to have something like the Muse monitor to help confirm what I'm seeing. So what I would do with this is, have the Muse on, and maybe we're not actually running the app for the Muse at this time. I'm using it more as a neurofeedback tool. And what that means is you can have this running and it will give you in various formats the raw data. Okay, and you can set that to record. So over the course of a session, if somebody's doing their trauma processing, and I want to be able to look at, internally, does that observe what I'm seeing externally? When I look at the brainwave states, I also usually have a heart rate monitor hooked up. So I'm looking at the heart rate, right? Is it elevated? Is it dropping? Elevated, we often see with kind of that danger or orientating response. We often see the drop in heart rate when there's life threat perceived and I'm shutting down. So that can be really, really valuable. And again, we see shifts in brainwave activity as well, depending on what state I'm in. And that's a little beyond what I can get into tonight, but I think it's really important to understand how we can use this to track what's happening internally, and help people to become conscious of what they're feeling and what they're noticing. It also demonstrates the capacity to shift things, right? So if we see that somebody's going into more of a dissociative or a shutdown state or more of an activated state, we're going to work with their energy levels to help promote regulation, but also help them to become aware of, what does that feel like? What does it feel like when I'm becoming hyper-aroused and I've got too much energy? What does it feel like when I've got too little and I'm shutting down? And that's so important, because when we're doing good trauma treatment, excuse me, I'm getting over a cold. When we're doing good, not even just trauma treatment, but treatment in general, we really want to make sure that when we're doing work with people, we're keeping them regulated. Now, that doesn't mean that there's not going to be distress, but our job is to titrate the distress. So we allow it to happen, but in a safe, structured way. What we don't want is somebody becoming hyper-aroused and being flooded with intense emotions, or hypo-aroused where they're shutting down, because that's just reinforcing those, unhealthy neural pathways, those unhealthy coping responses. So as we're tracking this and we help them become aware and we implement strategies such as using the Muse, that can be a great tool to help people not only know what precipitates kind of going outside of that zone of regulation, but also what helps me to re-regulate when I'm feeling that way. Part of what we're really focusing on doing is integrating. So as I mentioned earlier, right hemisphere is primarily involved with sensory. So sight, sound, smell, sensation of touch, our emotional mind, and certainly if we look at Linehan's model, when we look at DBT, we know that if we're all emotion, that can be a little bit challenging for people at times because we're quite reactive, right? And our emotions are experienced fully and very, very big, but with the absence of logic or reason. Or contrary to that, we can be primarily left hemisphere, and left hemisphere is the part of the brain that really likes to form meaning, really likes to make sense out of things, but it likes it sequentially. So 2 + 2 = 4, right? Things make sense and are very linear. Unfortunately, trauma disrupts that balance, right? As Bill Steele says, the founder of TLC, he says, 2 + 2 does not equal 4 with trauma. Things do not make sense, right? So we have a disruption of that balance. And we can see some people becoming highly left brain logical where they're not connected to the emotion, right? And what we optimally want is a balance of both emotion and logic. So we want to be able to tune into what we're feeling, but also notice and reflect on it with logic, with reason. But to do that, our brain has to be calm enough to allow us to tap into both. Right? So part of our role when we're doing work with clients is to teach them how to regulate and teach them how to bring down that arousal to feel safe, and then we can start reflecting. So for example, if we have the headset on for Muse, it may be something like, I know that when I hear birds, I'm being reinforced, but I don't hear the birds, so I'm frustrated. And so we can reflect on that from that right and left hemisphere, right? And really look at, well, what were you feeling at the time that you're listening for the birds and you were starting to get frustrated? And, you know, how was that pulling you away from that process of being present? Or it could be the opposite, where you know, we're calm and regulated and really embodied and enjoying the mindfulness process, and then we hear the birds, and that can be distracting. Right? So looking at each of those emotions that come up and processing from both the emotional and the reasonable mind, right? Reflecting on that, looking at messages I can send to myself if my mind starts to go, oh, I'm not hearing the birds and I'm frustrated, or if my mind shifts to, oh, I keep hearing those birds and it's distracting me. Those are our practices that we can implement to try and integrate both right and left hemisphere, but also to again, increase that mindfulness awareness practice. And ultimately what we're doing, we know one of the first things that happens following a traumatic experience is a lack of integration between the right and the left hemisphere. Trauma really, as Peter Levine says, the reactions that we have are normal reactions to abnormal events, but they're overwhelming events. And the overwhelming events decrease integration between the right and the left hemisphere, between the body, the nervous system, to the heart, to the brains. And what that means is where typically we have that crosstalk where the right and left hemisphere do communicate to one another. I feel something and I'm able to make sense out of it. Maybe there's activation and I'm able to remind myself that I'm okay. If there's no crosstalk, we have activation without the relief, right? Without the reframe. So an example would be, I had a really bad car accident years ago and honestly thought that I was going to die. And I did process through it, but had been away at a training that I delivered and was going down a very, very steep hill, very slowly. If anybody's from Newfoundland, I was in Newfoundland and their hills are straight down. And I was going down this hill and realized the car was not stopping. I was engaging the brakes way up at the top of the hill and it was not stopping. And I was coming to two intersections. And so unfortunately, it continued not to stop. The lights changed, thank goodness, right as I was going through. But what happened was that was a very activating event, right? It triggered, even though I had processed through what had happened, it triggered a little bit of that in my mind. And a few months later, when I was giving a training somewhere else that had a snowstorm, I was going down a little hill. big snowstorm, and activation happened. Now, when we have that crosstalk happening, we can use it as a resource, exactly like I did. So I'm going down this hill, my heart rate speeds up, my tummy starts to turn, my head's going, oh my gosh, my car is not going to stop. And the integration, accessing the left hemisphere, was able to say, hold on a minute. This is different, right? You're okay. You have snow tires. You have a big SUV. You're not in Newfoundland. This is a little tiny hill, and you're okay. And that's what crosstalk allows us to do, right? But that's also mindful awareness, and we have to be able to strengthen that part of the brain, because the amygdala, that security guard part of our brain, is so strong and so powerful, and rightfully so. It's protective for us, but it's so strong and powerful that we really need to work on consciously training the part of our brain that is involved with giving us strategies and helping us to reason and reflect. Okay. So when we're using the Muse, one of the other things that we use it for is, of course, biofeedback and neurofeedback. And I've touched on this a little bit already. But again, there are multiple ways that we can do this. So you can use it in the traditional way, where you're having people put on the headset and they're getting the feedback. I love the way that it's framed very positively. It gives you lots of positive reinforcement. It teaches you to be compassionate and kind to yourself. And that's really wonderful. But we can also use it to monitor affect. Okay, so we can use it to get a sense of what's happening in our brain and our body. And sorry, these are just some of the benefits of top-down approaches or training the brain. So when we're doing something like meditation and mindfulness, essentially what we know that it's doing is strengthening it's decreasing gray matter in the amygdala, which is associated with anxiety, PTSD, depression, trauma, and increasing gray matter in the hippocampal area, which is associated with memory, learning, emotional regulation. So not surprisingly, when we're targeting those areas and seeing those changes, we see enhanced attention and memory. We see improved retention because that arousal's decreased. We see better self-management and self-awareness skills. We see fear extinction because we're able to use that logic and reason to help us understand and evaluate what's happening. And of course, as we're more attuned to ourselves, we become more attuned to others, so we're better able to read and notice and perceive how people are feeling and respond. And what we know with trauma is when that amygdala is on high alert, and it's scanning for threat, I'm not noticing how I'm feeling, let alone noticing how somebody else is feeling. Right? So this really becomes a powerful tool for increasing our relationships with ourselves, but also with other people. So as we're using the Muse for affect, sorry, I'm just going to skip forward. This is the slide that I want. We're really looking at regulation. And this is where I was speaking about that optimal arousal zone a little bit earlier. Pat Ogden, Peter Levine, Dan Siegel, a lot of the leaders in the field talk about this. And I think it makes great sense. And whether you're a person who's listening in for yourself or whether you're listening in as a helper, I think this directly applies to our life. We know that this center zone that we see that's called the normal zone, or I call it the optimal arousal zone, is really where we're meant to kind of be. We're meant to have this ebb and this flow. We may come close to, you know, the edges of having too much anxiety or hurt or upset or fear, but we're still able to remain regulated. We may come close to having too much pain, sadness, you know, exhaustion, but again, we're still remaining in that regulated state. But unfortunately, what we know happens with trauma is it really drastically disrupts the balance, right? It brings us well outside of that optimal arousal zone, and we get either stuck on or stuck on off, or we oscillate between them. So when we're stuck on, this is like a hyper-aroused state, right? So in this state, I have too much. I have too much anxiety, pain, anger, fear, even too much excitement, right? Emotions are really intense. Everything's really amplified, and I'm stuck in that on state, and it just doesn't feel good. Or we have where we're stuck on off, and here I have too little. So this is our hypo-aroused state, and you know, we see things like depression and flat affect, but lethargy, just exhaustion. Both impact digestion, both impact pain, both impact, eating and sleeping in different ways. And what we know is that people can become stuck in these different states, but they don't stay there. We can only hold, huge amounts of fear or pain for so long before we shut down, right? And we only stay shut down for so long before we do something to stimulate. It's the part of our brain that says, I feel emotionally dead inside. I'm not ready to be dead. And some part of us gravitates to something that makes us feel alive. So from the perspective of cutting or substance use, I would call these false refuges, right? I have too much arousal, so I'm going to tend to gravitate towards something that's going to bring that arousal down. And what people don't realize is they're trying to regulate their affect. They just are misguided in their approaches. So if I have too much, often I'm going to gravitate towards perhaps a depressant, right? Something that's going to help me calm down. If I go too far down, I might use a stimulant to level that out, right? And what people are trying to do is to find that optimal state energetically that allows them to feel regulated. If I feel too shut down, then maybe I'm going to do something to stimulate. So the same applies to cutting, high-risk behaviors. When we're working with people, we really need to understand what function what they're doing is serving. So am I cutting because I have so much pain and I want to numb? Or am I cutting because I feel emotionally dead inside and, I need to see that blood to know that I'm alive? So we can really effectively target treatment when we understand where people are. And the same applies with the Muse. So although the Muse reinforces, coming to that state of calm, that's not always the way that I use it. In treatment, often I may use it to come to that state of calm, particularly if somebody is in that hyper-aroused state, training their body to that sense of calm. But I may also train them to a state of alertness. So if the default response maybe is to be more flat, to be more shut down, maybe I want to see if they can engage that active mind. Maybe I want to see if somebody can practice a neutral mind. So bringing to mind, and this is a great interpersonal training skill, bringing to mind a situation or circumstance that's emotionally dysregulating or distressing, and not typically a trauma, but something that's been frustrating or upsetting, and trying to see, using their breath, using the messages they send themselves, using what they do with their body, if they can shift to a state where they can look at that situation and hold that situation in their mind and remain in that neutral state, right? And it does take practice. So that means if they go into that active state or if they go into more of a shutdown state, it's about noticing that, right? And then coming back to that neutral spot. And from a true mindfulness perspective, that's what we want to train our mind to do, right? We want to train it to be non-reactive, observant, so we see what's happening, we can reflect on it, we can be compassionately curious about it, but we don't react to everything that's happening. We see it and process. Another thing that we do, as I mentioned earlier, is the body-based work. So we work on externalizing, promoting regulation, promoting a sense of empowerment, and again, being able to see what's happening neurologically when I do something like this can be really great. So we may bounce on the mini trampoline, and yes, I do this work with adults as well and train lots of professionals in how to do it. We may go in the sensory shaker, the ball pit that you see down at the end of the page, or a body socks, and being able to look at, okay, after I do something like this, what's happening in my brain, what's happening in my body? What do I notice? We had a mindfulness meditation group for teens that we ran, and we did pre and post neurofeedback baselines. So looking at what their heart rate and their brain rate was doing before the training, but also after. Right, and being able to see those shifts that are happening, and again, really encouraging and empowering for them to be able to not just notice what they feel, but to actually see what's happening internally. I think it's important to touch on dissociative states, and I know this is a conversation that I had with Laura, and I believe Ben a little while back when we were talking about their new Muse Connect program, which I'll touch on shortly. And one of the things that I said is certainly working with trauma. I have a lot of clients who, particularly when they start treatment, are experiencing dissociative states or dissociation. And what I noticed is that at times when they're hearing the birds, based on the affect that I'm seeing, they're actually in a shutdown state. And in more of a dissociative state. And when we look at brainwaves, that can kind of mimic that relapsed state, right? So what I often will do with clients is just say, when that happens, are you able to notice, right? So I had one client say, well, you know, I feel like neurofeedback doesn't work for me because I can trick the machine. And I said, well, you know, that's yours, right? You can trick it, or you can become aware of, when am I shutting down? Right? What's preceding that, and can I bring my attention back? Because for me, for that client to have the awareness that they were tricking the machine shows me that they were aware of when those shifts were happening, which from a therapeutic perspective is fantastic. That's what I want. I want you to be able to notice when you're shifting, and I want you to know how to bring yourself back. So what I challenge people to do when they're using the Muse, because it's still strengthening that part of our brain, is to notice, to reflect consciously on what has caused them to shift, to notice what they're feeling in their body, and to try to come back to a present, relaxed state. So there's a very big difference between having those kind of calm brain waves and not being embodied and not being present, and having those calm brain waves and being present and feeling it. Right, I'm feeling what it feels like to be in that state. And what I've found is, you know, with that conscious awareness, that can really help with creating shifts. And the more that we're consciously practicing that, the more effective it tends to be. A colleague of mine, again, Paul Fruin out of Western University, he and Dr. Ruth Lanius do some amazing work with complex PTSD and dissociation, and he's developed an MMTT program, a mindfulness, meta-mindfulness training program, and he has a great little journal, and it works very nicely with the Muse because it breaks down our experiences. So if I do have somebody that has noticed that their attention has wandered in session or at home in their home practice, they can actually delve into that and break it down according to, you know, the objective experience in their mind, the subjective experience, you know, what came up from the past, what they were feeling in their body, how that past stuff was interfering with maybe their present experience, meta, so that kindness that they can offer or reframe, and the ability to be embodied but also observant of what is happening without being too overwhelmed. So there are nice supplements that work very, very well with the Muse program to, again, enhance it. One of the other apps that Paul actually had made me aware of, and I'm going to talk about this briefly. I'll tell you, I've ordered the sensor. I haven't yet used it. I've just done a demo and a call with them. But there's actually a MindLift app that you can get, and you can get training in how to use this. And basically what it does is it takes the Muse and it turns it into a targetable neurofeedback machine. So I had been looking into a very expensive, and I hadn't told you this yet, Laura and Jeff, but I've been looking into a very expensive neurofeedback system, and Paul was presenting at our summer trauma conference, and he said, well, Lori, you don't need to do that. He said, just, you know, get this, get MindLift and get the sensors that go with it. So you can get extra little electrodes for, I think, like $60, and you can actually target treatment using the Muse to engage neurofeedback. So there are games that can be done to, you know, increase or inhibit, you know, whatever brain functions you're looking at inhibiting, whether it's slow wave or you're trying to increase fast wave and inhibit the slow wave, which is really exciting because A, it's affordable and accessible, and B, it's not, you know, something that's extremely complex to use, which is really lovely. And I like this little image that I found for MindLift because it looks at the 5 ways that we improve brain fitness, and it talks about exercise, which certainly is so important, but exercising our brain is also really important. And we do that through learning, we do that through meditation, we do that through neurofeedback, right? Meditation is on there because that certainly enhances our brain fitness. We do that through neurofeedback practice, getting optimal sleep, and eating optimally. And positive states. We know that when we look at brain health and body health, positive states increase integration throughout the brain and the body, negative states decrease integration. So when we're talking about integration between right and left hemisphere, or integration from our nervous system to our brain, all of this is really, really important. And in fact, when we have, when we're sitting in negativity or chaos or fear all of the time, it really does impact us at a neurological, physiological, also a cellular level. So when we're using something like the Muse to train people to a state of calm, to allow them to hold this, even if it's temporary, right? Because it will often be to start, this is still a shift that is happening, which is really exciting and really hopeful for a lot of people who have felt quite stuck. We also train people how to use the Muse in clinical practice. So we have a trauma and attachment certification program. We train clinicians all around the world, actually, which is quite an honor. And I travel regularly providing trainings to different agencies and organizations as well. And always love to include information about neurofeedback and biofeedback, particularly the Muse, because it's so economic and accessible, and it is geared towards clients, right? It's very user-friendly, but we offer workshops on neurofeedback and biofeedback to teach people how to actually apply them. And one of the things that we have coming up actually is a restorative retreat, and this is geared towards individuals who are looking to really focus on self-nurturance. So it's open to professionals, it's open to people who are just seeking to promote optimal regulation throughout the brain and the body, but we will be actually using the Muse as well as some other neurofeedback and biofeedback tools at this training to allow people the hands-on experience of practicing and trying and feeling and seeing what it does for them. So ultimately what we want to do, and I'm going to wrap up and open things up for questions in just a few minutes here, but ultimately what we want to do is create new neural pathways. And it requires repetition, conscious awareness, intentionality to do this. And that's one of the things that I love about the new Muse Connect program. It's a program, and I don't have the visual for it, and Laura, maybe if you do when I'm done here, you can pull it up. I didn't get that far. But one of the things that I love about it is Muse has actually developed a program where clinicians, if you're a helper or if you're a client and you want your therapist to be aware of your work, you can sign up as a helper, as a professional, to be able to track your client's progress. So there's this platform that allows you, if your client consents, to be able to track their use. And again, another fantastic thing about the Muse is you don't actually have to have the headset. Obviously, it's ideal to have it, but the app does work without the headset. So if we're training the brain and we're practicing, just even doing that mindfulness practice of meditating, you know, even though you're not getting the direct neurofeedback from the machine when your mind shifts, you're still reinforcing that sound and that state of calm, and ultimately training your brain. So when we're looking at the Connect program, it actually tracks an individual's use. So I can see as their therapist how many minutes they've spent meditating or using the Muse throughout the week. We can then reflect on how that felt for them. As I said, I often will have them use it in conjunction with a journal. So then I have that journal piece as well for times when it was challenging. That can be a great tool. And ultimately, as I said, what we're doing here is creating these new neural pathways. So Rick Hansen says, you know, when we're looking at new neural pathways, we want activation and installation. And many of you have probably heard the saying, neurons that fire together, wire together. So what this means ultimately is if we're working with somebody who constantly perhaps feels powerless or unloved, right, lonely, isolated, and I'm going to go with those because those are common experiences, we need to first have an experience of feeling loved or feeling empowered. And that can be real or it can be imaginary, right? Our brain can create this experience of what it would feel like to be empowered, excuse me, or what it would feel like to have somebody lovingly and you know, compassionately looking at us and caring for us and interacting with us. So we first need to have that experience. We then need to enrich that experience. So we want to make our experience as rich as we possibly can. Trauma is incredibly rich. There's nothing that's more vivid in our brain, and that's because it's tied in with life threat quite often, and our brain wants to remember it to keep us safe. But if we want to counter it, we need to include strategies that are equally as rich. So we really want to use all the sights and sounds and smells and sensations of touch. So I have the experience in my mind or a real experience of feeling empowered, and I'm going to enrich it. What did it look like, feel like, sound like to set a boundary, to be respected, right? I'm going to really focus on absorbing it and holding that feeling. And then the linking or the new neural pathways comes through repetition. So every time I feel disempowered, I'm going to notice that feeling of disempowered, but I'm going to call to mind that feeling of being empowered. I'm going to really focus on enriching it and absorbing it. And the repetition of that process over time, and it does take time, allows for new neural pathways or new neural networks to be formed and the old ones to become unhooked. You know, Joe Dispenza has a fantastic TED Talk on the topic that you can look up, and it's quite funny and gives you some visuals as well. With that, I just want to say again, I'm so thrilled to be here. I hope that you've learned a little bit about trauma and how you might be able to use the Muse in your practice, and we'll open it up for questions and go from there.
Wow, Lori, that was absolutely incredible. Thank you so, so much. What a wealth of knowledge you are indeed. This was probably one of the most the most informative webinars I've actually ever participated in, and I've been involved now in this field for a really long time. But you are so articulate, and you just aggregated a whole lot of information into a very short time. So thank you so much on behalf of all of us. And hopefully, I think, speaking on behalf of those that are listening, that was really, really incredible. So thank you.
Thank you, and thank you everybody for listening in.
Yeah, we've had quite a few questions. I would love to start actually in listening to your presentation. I actually have a burning question myself, and then I'll get to the questions from the audience. So I've recently been reading quite a lot about actually mindfulness and trauma, and some people are making commentary on how sometimes mindfulness, and more specifically mindfulness of breath, in relationship to trauma can also be triggering, because asking people to just go inward and focus on the breath without like an external reference point can sometimes bring up things, because it's bringing them to a place that maybe is not that safe. But there's been some commentary also on practicing mindfulness of breath in conjunction with soundtracks or something external to help sort of anchor them in the here and now. And I would love, you kind of touched on this, but I would love if you could sort of elaborate on, you know, how you think Muse might fit into that conversation.
Yeah, that's a great question, Laura. And I think that Muse is a perfect example of how we do that, really. It's quite brilliant. You're right. Anytime that we're doing, whether it's trauma work or mindfulness work, we really need to titrate that. So asking somebody who the body perhaps has been a source of terror or a boundary violation or perceived threat to go inside of themselves can be incredibly destabilizing. And that's why we should never do something like this unless we know how to to safely and effectively help people ground. But you know, there are nice, very structured programs to help people do this. And the Muse is a great example of that, because what we're doing is we're, you know, yes, asking people to focus on their breath, but asking them to focus on their breath as well as their emotional felt state, and tying it in with the sensory feedback of the water, right? And when things shift, although maybe I'm starting to become distressed, or maybe I'm starting to shut down, that audio feedback, because I've been primed for what that means, so we've planted that seed, right, allows me to be aware of that and shift, right? So it's a nice little distraction, but it also is a priming tool, right? And takes the practice and makes it a little bit less about me and more about, gee, can I control the weather, right? Can I control the soundscape? So it makes it a little bit safer.
Absolutely. And I also think something really wonderful about the Muse is I'm not sure if you're suggesting to any of your clients at this time to bring the Muse home with them. But I think that, you know, again, practicing mindfulness and practicing meditation to enhance mindfulness with a practitioner such as yourself more often than not is going to be extremely effective, because as you said, you know, hopefully the person that is coaching someone through practicing meditation is aware of, you know, their situation and how to effectively make sure that it's safe for them. But when people then go home and try to practice on their own, I think sometimes that's where things can maybe get a little bit off balance. And what's, as we've been speaking, what's nice about Muse is it can act as sort of that like mental coach to help you still stay in that place that feels comfortable and safe, while at the same time helping you to develop a consistent meditation practice outside of the clinic or the office.
Yeah, and I love the reframes that Muse offers, because it's exactly what I say. And, you know, oftentimes I'm thinking it, even though I've heard it so many times and I know what it says. I am always talking about compassionate kind of curiosity and not judging ourselves and just being aware. And it just is timed so beautifully, teaching us to be not self-critical. I think you had mentioned actually when I spoke to you about some therapy centers having multiple Muses on site, which they're leasing or renting out as part of their treatment to clients. And I think that's a phenomenal idea. It's something I'd like to build to at some point. But we have many clients that have purchased their own personal Muse because they've used it in session and they've really enjoyed it. And, you know, at times we do loan ours out, but it also gets used a lot in session. So until we get a few more on stock, then we don't often loan it out too much. But it's a great idea, because the more that they can practice this, the more effective it will be. And then going back to the neurofeedback training program that I talked about, the Mind Lift, obviously the more that you're practicing that protocol for that individual, the more effective it's going to be. So same with if you have those Muses that you can loan out and you have the app on it and the subscription on it, then you can use that to really accelerate and enhance treatment, which is quite exciting.
Indeed, and we'll get to this later. Thanks for bringing up Muse Connect. For those of you who don't know, we did just launch this product about a week ago, but there's been a beta for about a year now, and I'll elaborate on that in a little bit. But within that, we actually offer a whole bunch of protocols, and this webinar will be available within Muse Connect after today, as well, along with many, many other webinars and case studies and, again, protocols. But we have a ton of questions. So the first one I think actually is very relevant, because a lot of people don't know what the difference is. A woman has been asking, can you actually explain, Alessandra is her name, what the difference is between mindfulness and meditation?
Yeah, it's a great question, and they often do get linked together, and classically trained meditation instructors don't like that. So mindfulness is really training the brain to a state of conscious awareness, right? And that would mean I'm noticing when my mind is shifting. It's not to say that my mind won't shift. It will. That's what our brain, by and large, does. It tunes into things around us. But it's, as Tara Brock and several other mindfulness practitioners will say, it's the serve and return. It's the noticing my mind has wandered and bringing it back. Noticing it has wandered and bringing it back. So that's, you know, the process of mindfulness. It might be mindfulness of eating. It might be mindfulness of what's happening internally. It might be mindfulness of my surroundings. There's, you know, unlimited ways that we can use mindfulness, and we can use it for grounding and regulation purposes. We can use it to enhance cognitive acuity, emotional regulation, so many, many things. When we look at meditation, meditation is a tool to increase mindfulness, right, from my perspective. So meditation, we are again, training our brain and our mind, but we're doing it either with focused attention. So it might be, you know, again, we tend to start with least intrusive and work to more intrusive. So it might be a guided meditation, where I'm leading somebody through a guided visualization or a meditation practice. It might be meditating on a sound. It might be meditating, you know, Muse would be an example of that, the water, right? You're meditating on your breath and meditating on the sound. It might be meditating on an image, right? So there are many different things, but it is that focused attention, but it usually has that assistance, and then you're training to a point where you can bring yourself to that state of, ultimately we want that state of relaxation for the brain, to calm the brain and the body, but that comes with a great deal of practice of learning how to sit and be with oneself and be regulated and safe in doing so.
Wonderful explanation. Thank you so much. So we also have another question from Eva, who was wondering if you can elaborate on how you use Muse Monitor.
Mm-hmm. So the Muse Monitor, as I said, we use it typically just to monitor affect. So you would pull up the app on your phone or tablet, and basically if you have the Muse on, it actually, instead of having the Muse app running, you would have the Muse Monitor app running, and I'd love to see you guys develop something internally as well. But you would have the Muse Monitor app running, and it shows you the brainwave functions, right? So we're just tracking, as I said, we often use it in conjunction with a heart rate monitor as well. So we're looking at the heart rate and we're looking at the brainwave patterns. It's recorded, and so I generally have what's happening. You know, I can look at over the course of the session when that happened, and we do video and audio record our sessions as well. So it's easy for me to kind of backtrack and look at what were we talking about at the time, what did I make in my notes around what I was observing with the affect, what was happening internally, and does that match? For court purposes, that can be really nice as well to provide some of the science behind what you're observing. And then we also use it for assessment purposes. So we may look at baseline, you know, brainwave, heart rate, and we kind of track it throughout. So what does it look like when we've just done a down-regulating or an externalizing exercise? What does it look like when I've just done the Muse, right, and I'm in a calm state? What does it look like when I'm in active mind and I'm thinking about something? So just again, helping us to become consciously aware of what our body feels like when we're in different brainwave states.
Thank you. So Kate is asking quite an interesting question that I think you probably just answered, but maybe can elaborate on. She said, I'm wondering how you get the data for clients while in a therapy session. Do you set it up as a usual meditation session and use the data that's generally provided? And as an EMDR therapist, I'm wondering if you've used it during EMDR. And then I'm going to actually tag in David's question is, also, have you used Muse for ADHD conditions?
Yeah, so all of those are really good questions. Yes, I did kind of just answer part of that in the last. So it is hard to monitor that stuff while you're actively with somebody, and certainly if you're doing EMDR, right, or something that you're really focused in on that client, pausing to kind of do baselines or see what's happening would be disruptive. And that's where, you know, with the Muse monitor, it has a record function, so you can hit record. So if I hit that at the beginning of my session, and my session is an hour, and, you know, I have my sessions recorded, it's very, like I said, it's very easy for me to, on my video and audio recording of the session, to go to that point and say, okay, this is 35 minutes into the session. This is where I observed activation affectively. Now I can go to that Muse monitor and kind of look at what's happening there over the course of that session, and be able to reflect on that. Sometimes I have used like a screen recorder as well that can record the data if I want something a little bit longer, and that picks up the sound as well, which is quite nice. So there's multiple ways that you can use it. And then with regards to the question around ADHD, and sorry, with the EMDR, yes, we have used the biofeedback and neurofeedback while doing the EMDR or EFT, not as much. So the core, I would say, our core treatment approach really is highly effective. It's very, EMDR and EFT are fantastic treatment approaches, but I find generally after we've done the trauma processing, the intrusion symptoms that our clients experience, which tends to be the most destabilizing, either stop or drastically reduce. When I would use EMDR or EFT for myself in our practice would be if somebody's still stuck. Right, so if the traditional kind of approaches that we're using haven't shifted them or haven't shifted them to that degree. So we don't use it as much. It's a tool that we do use as needed, but I don't use it as much as somebody who is perhaps an EMDR practitioner and that is their primary approach to treatment. And then with regards to the ADHD, yes, again, that's not our primary treatment approach. We get people typically for trauma, but attentional issues and children or youth or adults who have been diagnosed with ADHD or bipolar or borderline or, you know, you name it, we have come to treatment. Our treatment approach is pretty consistent because we're working with affect. Okay, so coming back to that window of arousal, if we're working affectively, we're working with somebody's nervous system, their brain and their body to promote regulation, the diagnosis to me is not as relevant. Okay, what's relevant to me is being able to track, are they in a hyper-aroused state where they're either, you know, hyper-aroused or highly distractible or highly angry, you know, or highly fearful, and if so, what can I do to bring that down? Or are they shut down, right? And what can I do to stimulate that, to create a shift? So hopefully that answers those questions.
I think it definitely does. Thank you. So I'm just going to make a note to everyone listening that it is 9:02 at the moment. So if anyone needs to go, now would be a good time. We do have 3 more questions. Lori, are you okay to stay and answer those?
Yes, of course.
Wonderful. So we will finish with those, and then I'm just going to show you a little bit about Muse Connect. So we'll be on for about another 10 minutes. So we'd love for anyone who's able to stay. But for those who have to leave, thank you so much for joining us. The next webinar will likely be a deep dive into Muse Connect. So we hope you can join us for that. And so the next question is, can we see brainwave examples of what integration looks like? I think that's an interesting question.
That's a phenomenal question.
Yeah.
So neuroscience absolutely is an area of interest to me, and I think if I do ever go on to do my PhD, it will be in neuropsych because it's a learning curve and an area of passion. I don't know. I have
yes.
colleagues I can ask that question. I'm sure, yes, I'm sure we can, because when we look at things like the video clip I mentioned of Joe Dispenza's, he actually shows you a thought. So he actually shows the brain kind of branching out, which to a degree would be part of that integration and connecting. right? So we can see that with the right technology. I'm sure that, you know, people like Paul Fruin that I mentioned that study neuroscience and study the brain, you know, Marty Teicher out of Harvard, I'm sure, yes. Do I know that? No. Do I know what it looks like in session? Yes. Good
Great,
question.
thank you. And I think that kind of ties into Carrie asked, when you are using Muse Monitor, which brain waves are you observing and what are you noticing?
Yeah, so it's individual specific. And what I'm really looking at is what's happening for that individual. So is there, you know, are they going towards more slow wave or kind of shutdown states? Are they going to more active states? Like I'm just looking at changes. So it's not so much whereas when we're doing targeted neurofeedback, that can be a good baseline to understand at a very basic level, or you can do that through observing symptoms as well, what kind of protocols you might want to target to help people. But for me, when I'm using the Muse Connect, it's more just of an observation. So it's not, I'm not trying to increase or decrease anything at that point in time. I'm just being curious and basically having some insight to the brain and what's happening. So for me, it's really neat to be able to pair up. So if I see somebody, for example, I'll give you an example of a little girl that I was working with. She had come for an assessment. She had the heart rate monitor on and the brainwave monitor, but it was the heart rate monitor that more so drew her attention at the time. So she was doing her trauma processing, and I noticed that her heart rate spiked. And I didn't get to looking at the brainwave stuff because it all happened so quickly, and this is what our affect does. So she went into this state of hyperarousal, still, you know, manageable, not at a debilitating or distressing level, but there was activation. So this is where that kind of threat is perceived. Then her heart rate dropped, and it dropped so fast that she said, she was like 11, and it said, the machine said no pulse detected, because it's a pretty simple machine. And she looked at me and she said, well, I guess I'm dead. And I said, well, fortunately you're not, phew. But I said, what happened there is this machine was not sophisticated enough to understand why there was that sudden shift. Now our brainwaves are different because they're ebbing and flowing all the time. But with our heart rate, you know, it spiked so much and dropped so quickly that the machine's like, oh, something's wrong here. Right? So it was a great opportunity to, again, tune in and notice what she was feeling in her body, where she was feeling it. We went into our sensory room or the yoga room. We did some sensory regulation work. We went back to, you know, the trauma processing, which is what she had been doing at the time. I said, what happened to those feelings here, here, and here? And she said, oh, they're gone. They're out the window, right? And began doing her work again. And at the end of her day and a half said, you know what, this was really fun and I feel a lot better. When can I come back, right? So I think for me, it's more of that. Is it matching with what I'm seeing? If I'm seeing a shutdown state for a person, am I reading it correctly? Which generally I am. And it's reinforcing. Right, and because I work with a lot of, unfortunately, a lot of court-involved cases, again, you know, if somebody's saying, and it's not to prove that something happened, but certainly I get a lot of, unfortunately, sexual abuse, and people will say that it didn't happen, and, you know, affect matches. When affect matches what's being communicated, it just adds to that assessment component. It just adds to the evidence that's presented.
Thank you so much for sharing that. And funny that you should say someone's, you know, mentioning like, am I dead? Because we actually so often when it takes like a few seconds for the Muse to connect at conferences and things when I'm demoing people and they won't see their brainwaves, everybody says that they're like, well, I guess I just don't have a brain.
Yeah.
But patience is definitely key, and I would definitely agree that, you know, one of the most amazing things about having this external feedback and the analytics is indeed to be able to sort of then analyze whether the experience that the individual had matches the results, and if not, why might that be the case?
Yeah, yeah, absolutely.
Yeah.
Absolutely.
Okay, so we have two more questions, but one is not really a thought-provoking question, but so I'll start with the sort of the last question, which is, with a dissociative client, what is a favorite strategy to have them safely feel again?
Mm-hmm. So again, key there is titration, right? So titration is the concept from a scientific perspective that we can take two substances, mix them together, and they can be explosive, or we can take those two substances, the same ones, mix them together drop by drop, little by little, and have them mix just fine without the explosiveness, right? So I think the key to working with dissociation is integration, but integration and presence and embodiment in a way that is safe. I really titrate not only the amount of time, and that's another great feature about Muse, is you can set the time that you use those sessions for. So you can start with even 1 minute or 2 minutes, and you can build right up to longer sessions depending on comfort. But when I'm starting with having people to focus on mindful awareness or be embodied or focus on the breath, I'm going to start with a shorter time frame. Okay, I'm going to notice whether it's regulating or distressing for them. So some people will use the Muse and it will be destabilizing, right? Because I'm familiar with chaos, you want me to sit and do calm, and my body and mind are just not accustomed to that, right? So we want to gradually train to comfort with calm, as Julie Alvarado says, rather than comfort with chaos. Or for other people, it will be incredibly regulating. So time is important, understanding the impact that it has on the individual is important, and then content is so very important. So if I were actually doing a meditation, many people will self-seek meditations, and they'll come across something that's long and very emotionally charged, and then they'll become turned off of meditation because it made them feel too much, too fast, too powerfully, and it was scary. But if you're doing it properly, you're not starting with something like self-compassion, which is so important, but we move to that much later, right? You're starting with something like awareness of surroundings, awareness of breath, and building to that. So how we safely get people to be embodied, again, the Muse is great because it's more externally rather than internally focused, even though it is about, you know, being aware of that biofeedback, that neurofeedback that's happening. We're focusing on the waves. So that's where it becomes an external reference point, and is quite nice and safe. I will say many of my clients who struggle with dissociation, and I'm not sure why, really. I have theories, but I'm not really sure why, but I have a teen in particular that's very highly emotionally charged, and she puts on the Muse, and man, it shifts her, and not into a dissociative state, it shifts her into a regulated state. So it's really fantastic to see, and for her, it helps her regulate. And I think that's the kind of stuff that we want to work to. So when you're working with someone with dissociation, it's, you know, really being mindful of the techniques that you're using them in a safe, structured, titrated way, but also tracking what's that doing for them, right? If it's distressing them, is it tolerable, and can we be curious about it, and can we regulate through that, or is it destabilizing them or causing them to dissociate, because that's not the ideal. So hopefully that helps.
Yes, wow. And you know, it really is so touching and wonderful for me personally. And I know I can speak on behalf of everybody here at Interaxon to hear stories like that, real life examples of how Muse is changing lives and being used as a really, really effective tool to help people become connected with themselves in a deeper way. So thank you so much for sharing that one story, and I would love to hear more at another date. So with that being said, the last question is actually from almost everyone in the audience. They were wondering if it were possible to get a copy of your slides.
Yes, yeah, I'm absolutely fine to share that. The only thing that I won't include is the client artwork that was at the beginning of some of the slides. I do have permission to share it, but I don't circulate it.
Wonderful. Thank you so much. And I think the fact that literally almost everybody wrote in saying, yes, me too, I would love that, is just a testament to how engaging and interesting this webinar was. And I feel like you are truly such a breadth of knowledge and wisdom in so many different areas. And I look forward to continuing to connect with you and involving you in the Muse Professionals community for a long time to come. So thank you again so much.
Thanks, Laura. Are you about to shift into the demo part now?
Yeah, I'm just actually going to, I'm just going to switch my screen right now.
And I may say goodbye if that's okay. My daughter's got a soccer game, so I'm going to go scoot out and watch that. It's just starting at 9. So.
Yeah, absolutely. Thank you, Lori, so much. It was such a pleasure to connect with you.
Okay, wonderful. Take care. Thank you.
All right, and for those of you who are still listening, I just wanted to show you that this is the home screen of Muse Connect. So as you can see, www.choosemuse.com/connect. We have just launched this incredible product this week, and essentially Muse Connect is a online digital platform that will allow you to remotely monitor your clients and patients at home meditation sessions with Muse. So this is incredible because immediately once your client has completed a session, it will upload under their profile, and within Muse Connect we actually draw out a whole bunch of analytics to help you better understand what's been going on for them in that meditation session. It gives you aggregated data over the week. It shows you big shifts. So if a client is actually dropping off, they haven't stuck to their protocols, it will let you know. So it's an incredible way to extend your relationship with your client beyond the office or the practice, so that they also know that you're supporting them and therefore also helping them to build a consistent meditation practice. Some of the other incredible features are webinars like this one today, along with, as I mentioned earlier, protocols that other professionals in our community have laid out, many case studies, and so much more are inside of Muse Connect and available to you at any time. Our research studies, we work with actually over 200 major research institutions such as Harvard and the Mayo Clinic, Spalding Rehab, University of Toronto. All of that information is also going to be available within Muse Connect. We also have the capability for you to receive discounts on practice-wide units for yourself and for your clients, which is really nice. So it makes Muse a bit more accessible to your clients, as well as available to you to actually use with your clients or loan out to your clients to be used in practice or again at home. And again, we have resources to help you sort of, if this is of interest to you, to actually market that this is a part of your practice, that you're using transformative technology in your practice, and this is something, you know, showing some innovation and that you're trying to revolutionize what it is that you are doing. Again, we have, here's just some sample protocols, and overall, Muse Connect is a really amazing tool to help you take meditation to another level with your patients and clients. So I'll leave it at that, and I look forward to connecting with you all. We will be doing a webinar. We think it will be the next one where we actually go into Muse Connect and you can take a look around. In the meantime, if you are interested in joining Muse Connect, please reach out. You can purchase a single unit at, in Canada, $249, or in the States, $199, which is actually cheaper on both ends than the retail value, and it will give you a 1-month free trial on Muse Connect. So if this is interesting to you, please reach out to me. Many of you probably have my email, but it is Laura, L-A-U-R-A, at interaxon, interaxon.ca. So thank you again so much for your wonderful questions and engagement, and I very much look forward to hearing from all of you. And if any of you are interested in hosting a webinar with us and are already using Muse in your practice, we would love to hear from you. So again, please email me, and I hope you all have a wonderful rest of your Wednesday evening. Bye for now.